live. So please reach out to everyone on social media, wherever, and just tell them that we're here. We're starting now. Um, we have over 100 people who registered for this webinar. I'm looking for all of your faces. Don't miss this moment. We have less than 40 minutes to go. And then, of course, you can still share the registration link. So I'll be posting the registration link here. So if you know anyone who can benefit from this, any healthcare provider, you can invite them. So it's 11:10. Good morning, everyone, and welcome to today's panel session. And we'll be having a very exciting moment today. I'm absolutely delighted to welcome you all to today's webinar panel session, and it's titled "The Fundamentals of Quality Management in Healthcare." You can see my backdrop. That's what we'll be talking about today. So my name is Obina Mariso Koronko, and I lead the Learning and Development Department initiatives at EHA Clinics. And today we'll be discussing this all important topic with my panelists who are already here. So I have Rukayat Yunusa, who is our supply chain manager, and who's our supply chain manager. She's a licensed pharmacist with a strong background in healthcare management and systems strengthening. She's a graduate of the University of Jos, holds a master's degree in supply chain management. Is a certified internal auditor for ISO 9001 2015 quality management. Spans both public health and private sector management with a focus on building resilient systems so that improve service delivery and patient outcomes. She currently serves as a supply chain and quality manager at EHA Pharma, where she oversees end-to-end pharmaceutical supply chain quality systems implementation and operational excellence. Her passion lies in using data-driven approaches to optimize healthcare access to reduce waste, institutionalize quality at every level of supply chain. Rukaya, can you just put on your camera so that our guests get to see your face? You're welcome. Good to have you.
Hello,
How are you
everyone.
doing today?
Fine.
Yeah,
Happy to be
yeah,
here. Thank you.
yeah. Good. Right. So another of our guests today is Dr. David Asham. So Dr. David Asham is a distinguished senior medical doctor and management expert, currently serving as the Assistant Practice and Quality Assurance Manager at EHA Clinics, Kano. He has a wealth of experience in medical and surgical practice, healthcare management, and practice on quality assurance in healthcare. He has earned various management certificates both in and out of the country. He is also a seasoned public speaker and an administrator committed to promoting quality-focused, patient-centered healthcare. So Dr. David will welcome you. Would you put on your camera, please? Thank you, Dr. David. How are you doing today?
Hi, everyone. Good morning. Nice to be here. Thank you.
Right. And then our next guest is Fatima Abubakar. If you attended our webinar with SQHN, all right, she was our lead speaker. Dr. Ashton, would you push back your seat a little part of your yes. So Fatima Abubakar is the sorry, that is just coming up, is the assistant manager, lean and quality in continuous improvement at AHA Clinics. She's a passionate advocate Okay, she's a passionate advocate for excellence in healthcare. Fatima has been instrumental in driving lean healthcare maturity at EHA Clinics at an all-time high of approximately 86%. She has also developed impactful e-learning courses on tools for quality improvement, lean healthcare, and incident management, and more. With a bachelor's degree in nursing science and certificate as a Lean Six Sigma Black Belt, Fatima specializes in implementing and improving lean healthcare processes and quality management systems. Her dedication to learning, experimenting with innovative ideas, and sharing knowledge underscores her commitment to fostering continuous improvement in healthcare. In her free time, Fatima enjoys exploring new concepts, applying them in practical ways, and inspiring others through knowledge sharing. She's my go-to person for a lot of things. Can we welcome Fatima Bubukar? Can you please put on your camera, please? Hi, Fatima. Are you there? Yes, you are.
Yeah, hi, Obinna. It's great to be here.
Yeah. Thanks. So I'm glad to welcome to my panel. Right. So thank you all once again for being here and bringing your rich expertise. Now, this event is brought to you by EHA Clinics Academy, the learning development arm of EHA Clinics, a leading healthcare provider to delivering high quality, evidence-based and patient-centered care across Nigeria. Our academy exists to nurture healthcare professionals through continuous learning, professional development, and innovation in health education. We are also proud to co-host this webinar in partnership with El Razi Medical University, a rising institution dedicated to medical excellence and academic rigor. Together, we share a passion for advancing healthcare quality and strengthening systems through knowledge and collaboration. Now, so our guest from El Razi, that's Mr. Bapi. Mr. Bapi, are you there? Would you put on your camera and say hello?
Hi, good day, everyone.
Oh, that's Mr. Mark. Yes.
This is Mr. Mark. It's nice to be here. Nice to be here. Good morning, Mr. Marazu and everyone.
Thank you very much.
Thank
Good to
you.
have you.
Good to
Yeah.
have you.
So,
Thank you.
Mr. Mark is the registrar at El Razi University, right?
Senior Assistant Registrar, sir.
Oh, sorry. Senior Assistant Registrar at the Razi University. We're glad to have you.
Thank you.
Right. So now to today's, yeah. Please, can you mute? Can you mute? Right. Thank you. So now to today's conversation, quality management in healthcare. As we all know, ensuring consistent, safe, and effective care is not a one-time effort. It's a continuous process. So today's discussion will help us unpack the principles, strategies, and the real-world applications of quality management, especially with the unique context of our healthcare system here in Nigeria, from tools of improvement to incident management. We'll be discussing some of these things, and we have our seasoned experts who will be leading us through in this conversation, in the panel conversation we'll be having today. Welcome once again. Please, if you would have a reason to ask a question while the webinar is going on, you have your Q&A session. You can just drop in your question. I hope you know that this webinar is actually a free, well, I say like a discussion, because we have just recently developed a course titled the same title with this webinar, Fundamentals of Quality Management in Healthcare. We did this in collaboration with Erazi Medical University. So this course is a 4-module course. It's titled Fundamentals of Quality Management in Healthcare. There are 4 modules: Basics of QMS, Tools for Improvement, international patient safety goals, and incident management. Now, these are the 4 areas that were thoroughly dealt with and discussed in our course. Now, if you are a clinician, a health administrator, a student, and you've heard anything about quality management system, I feel that this course will be great for you. And what is more, the NME, Nigerian Medical Association, has also backed up this course with 10 CME points. So it means that if you take this course with us, you also have the privilege to do to have a certificate for your licensure by the next time you'll be doing your license. All right, enough of all the preparatory speeches. Now let's get to the root of the matter. So I'd like to start with you, Dr. David Asher. What inspired the development of this course and why now?
All right, thank you very much, Obina, for that question. Good morning again, everyone. Yes, so we have looked around, and if you see, let's look at Nigeria, and we can take it out to other countries, and then outside, you can see that patient safety is a problem. If you look at the healthcare sector now, you will see that it is plagued with so many challenges that compromise the safety of patients, right, when they access care anywhere. And so we will hear different stories of how somebody went in for surgery, something happened, they didn't come out alive, they forgot something somewhere, how somebody was having, went to the hospital, developed another form of infection, came back, and then had another issue with various complications. You look at the lack and negligence that you see in healthcare settings nowadays, and you're looking and you're like, these are patient safety issues, and many people are either not aware or aware and nothing is done about it, right? So you have healthcare organizations, however beautiful the building may look, but their systems do not deliver quality. Neither is there patient safety when they are delivering healthcare. So you have millions of people every day going into hospitals, right, to access care. And you find out that on a yearly basis, about 136 million people are harmed when they access care because of unsafe healthcare practice that is done in hospitals. And that leads to about 2.6 million deaths yearly. And then if you do the calculation, you'll find out that about 1 in 10 patients are harmed every time they access care in hospitals worldwide. 1 in 10. That's like you're saying 1/10. And the harm can come from various ways. Medication error, studies have shown that is responsible for about 12 to 13% of harm. Diagnostic error, so when the doctor makes the wrong diagnosis, that's responsible for about 69.5% of harm. So that means about 6 to 7 out of 10 patients will be harmed from wrong diagnosis. Hello, right? Negligence responsible for about 27.9%. That is about 30% roughly. So 3 out of 10 will be harmed due to negligence, right? If you look at the infrastructure of Nigerian healthcare system, it's affected because it's dilapidated. About 40% of all healthcare systems have poor infrastructure. And that affects patients, healthcare delivery, right? In fact, one of the data that even shocked me when I read the journal recently was Nigeria's birth stage rate per 1,000, 0.5 to 1,000. So where is the delivery of healthcare? So we need to have a system, right, that is tuned to ensuring delivery of healthcare system, to ensuring that, patients get safety when they come into the clinic. So I mentioned just now that 1 in 10 patients are harmed, right? Would you want to go into a clinic, right, and travel where you see that 1 in 10 errors can occur if you enter? Can you travel in a plane when you're aware that 1 in 10 errors can happen and it will crash? A lot of people would not, because it can be somebody today, it can be tomorrow. 1 in 10 is a high number, right? And so you see, this is the reality of healthcare. And that's why we are having this course now, to build and encourage, build awareness, make people understand what quality management system is and how we can use that in our space, wherever we are, to improve quality management within our healthcare practice on a daily basis. I think that's just summarizes that.
Yeah, thank you, David, for that scenario and the statistics that you also share. That really should get on mind thinking. So Rukaya, so what is quality management essential in healthcare today? Following up with what Dr. David has just said, why is quality management essential? Maybe you can build up that a little.
Okay, Obina, thank you for that very important question. But to answer this question, I would give us 2 case scenarios. And I know my co-panelists have given a lot of examples, but I will give us 2 case scenarios that we can relate to. Imagine walking into a hospital for a simple IUD insertion procedure. only to live with an infection, which could have been prevented. And it could be as a result of the nurses not following safety procedures. Or another scenario you can imagine is a patient that was prescribed amlodipine for hypertension, and mistakenly, a medication for congestive heart failure, digoxin, was administered to this patient, and this resulted in harm to this patient. So this, in the Nigerian context, we have had too many of these kind of scenarios. So poor quality healthcare leads to increased mortality, longer hospital stays, and even higher healthcare costs. So the essence of quality management in healthcare is to prevent these kind of situations from happening. So quality management system in healthcare refers to a systematic approach to ensuring that healthcare services meet established standards. Example of standards that we have related to healthcare quality is the JCI accreditation standard for healthcare quality. The ability for them to also meet regulation and best practices to provide safe, effective, and patient-centered care. So by measuring patient outcomes through data collection, so what this is trying to say is that in quality management system, there's a lot of areas we're looking at. We're looking at continuous improvement processes. We're looking at adherence to regulatory guidelines, risk management, etc., which we've explained in details in the course. So by measuring patient outcomes through data collection, I'll give an example in relation to the scenario where I gave you regarding medication error. Imagine if you're able to gather this data, identify gaps in this data. So let's give an example that maybe for this particular medication error that happened, it could be maybe a dispensing error because both medication, maybe they look alike in terms of their packaging. So you're able to identify the gap. So what quality management system framework does is that it gives you that room where you're able to identify the gaps and also to implement corrective actions in order to improve that particular process. So maybe after this particular medication error, for a system, for an effective quality management system, when you have such kind of situation, you're able to implement corrective actions to make sure that such situations do not reoccur. So in summary, I would say quality management system is crucial in healthcare today because it directly impacts patient safety and also improve patient care outcomes. Thank you, Obina.
Thank you, Ruki, for that very beautiful presentation. I'm sure our guests are beginning to appreciate the. Now, need I say that everyone who is talking here was part of the course developers, right? So if they can say the much they're saying here, that tells you how much more in-depth are in the course, all right? So I'll go to our dear lead champion, Fatima, right? So Fati, in your opinion, what is the greatest challenge and the greatest opportunity for quality improvement in Nigeria today? Sorry, Fati may put off her camera for a while. She's having some network trouble, but I'm sure you will hear her voice. Yes, Fati, please go ahead.
Please confirm if you can hear me.
Loud and clear.
Great. So if you ask me, the greatest challenge with quality management in Nigeria at the moment, I would say two things, but they are basically the same thing. So first off is the foundations or structures for quality management, right? And then the lack of reliance or the lack of utilization of data-driven systems, right? So these two things, they're kind of interrelated because a proper quality management system actually would, incorporate the collection of data that, helps you monitor, the quality systems and improve as you go. So again, this major challenge is actually an avenue for improvement because it's like I say, as much as we talk about the numbers that have to do with, patient harm and things like that, it's not like care providers wake up in the morning and go to work hoping to or planning to harm anybody, right? Everybody wants to give their best, right? That's why they're in this profession in the first place, because, you want to make people better, right? And you want to be able to do it the right way Nobody wants to do the wrong thing. Nobody wants to harm anybody, right? So if we know that, then we know that if harm is still happening, then it's surely must be that we probably don't have the right system in place to support these providers to be able to provide the best care that they can. And that is again why having effective foundations and having effective quality management systems and data-driven systems is very, very important. Yeah.
Thank you. But you talk so much about having quality-driven systems. Wow, I love the sound of this. So now I hope you're paying attention and following. There's a cost to get the full gist. Okay, my assistant will be dropping the link to the registration of this course on the chat box. All right, so that while you are enjoying what is going on, you can also register for the course. Now, for everyone who is attending this webinar today, you have a discount, all right, of only 30,000 naira, all right, to register for this course. And the course launch is on June 9, all right. And extensively, each of the modules of this course being discussed, will be treated. And of course, we're going to, for everyone who eventually becomes part of that course, would have a session to have hand holding, okay, because we know that quality implementation is a journey, it's not a one-time do. In fact, if you know anything about that, you know that there will always be audits by the regulatory bodies that have given you this accreditations, all right, because quality is not a destination, it's a continuous journey. There's always room for improvement. So, Fatih, I'll go with you again. So, how does this course align with global quality standards? What would you say about that?
Well, if you think about it really, globally, first off, quality is everybody's business, right? And as much as, we're not where the advanced countries are, we know that we want to improve, right? But then looking at global standards, right, even for the model that talks about international patient safety goals. So these are not just, topics that or concepts or goals that we came up with on our own. These are based on actual regulatory standards on what patient safety should be like, right? So what they did with the IPSJ is that bodies like, you have your Joint Commission and the like, sat down and looked at the critical areas where we have patient safety issues. And they developed patient safety goals around them that basically tell you what the basic things or the first things, the things that you need to prioritize when you want to set up a system that would support patient safety. So a lot of the things that we're going to talk about in the course will refer to standards or information or resources that are aligned with standards like your Joint Commission, your ISO, and the like. So basically, recognized bodies that have put in standards and sets requirements or guidelines for how things should be done to help you achieve that quality care, right? So yeah, this course basically aligns with those standards, to name a few.
Okay, thank you. Thank you, Fatih. And so, Dr. Ashim, how can participants maximize the value of this course, both during and after completion? What do they stand to gain?
Yeah. Thank you very much, Obina, for that. I just wanted to lend in a voice to what Fatima has just said. A bad system will beat a good person every time, right? You may have the best of intentions. You may be a good person at heart. You want to just get it right? But if the system is bad, it will just keep creating this vicious cycle where you're just moving around and not making any significant impact. And that is why we are talking about quality management system in healthcare. And if you take note, quality management system, you're trying to change the system from what it is now to where you want it to be, right? And that's very important. And the famous words of Titanium, so where there are no standards, there cannot be any improvement. So you need to have standards, right? And that's why we're having this course as well again, so that you can now use those standards to improve, right, those patient safety issues that are present in your own organization, right? Now, looking at how you can maximize, right, I would advise that you use the approach of trying to be proactive, right, trying to be reflective, and then have an application approach, right, to this very course. So if you are proactive, you'll be eager to learn. So I'm going to advise, right, that all the content that you need as far as quality management system fundamentals, you can find them in this particular course. And it's a good thing that we're having it today to create awareness, right, about QMS in health. And so, of course, everyone should be proactive to get to understand and know this, right? So please, if you haven't registered for the course, I advise you go in there, get registered so you can have the necessary knowledge to begin to effect changes in patient safety issues in your organization. So aside from being proactive, you need to be reflective, right? Because being eager to learn, proactive, you need to think deeply about the things you have learned, right? I think, Obina, correct me if I'm wrong, I think if you go through the course, you have lifetime access, right? Lifetime access, exactly. So you see, when you pay, it's not just a one-time thing. You can go back again, make reference to the things that you have learned, to think deeply around what you have learned. And then the last is to have, an application approach, to what you have learned, to see how you can begin to implement some of these things in your spec. You can start small, right? Like we've been saying here, quality is a journey, not a destination, right? It's all about improving at every step of the way. It's all about trying to make sure that you take those little steps, right, towards patient safety. So please be proactive, right? Reflect on what you have learned, right? And begin to apply these things, right, in your spec, and you will see changes happen. I think that is the best way, to get the most value from this course. Thank you.
Thank you very much. While we were preparing for this webinar, one of our senior managers said she's afraid of the panel team that I have because everyone is passionate. Now, I wanted them to talk very briefly, but everyone has been verbose with explanations and all that. And that's how rich, the content of this courses actually are. So, Rukaya, what's practical?
Sorry, Obi, I had my hand up.
Yes.
I just wanted to pick it. I know
sorry.
we want to keep the time, but I really feel like there's something important I wanted to add to what Dr. David has just said regarding the question he just answered, right?
Right, just go ahead.
So one thing that talking about how you can maximize the course and all right. So when we developed this course, right, we did not develop it in mind that we just want people to develop it and get their certificates and CNA. Right. So first things first, understanding that all of us that develop these courses are clinicians first. Dr. David is a medical doctor. I'm a nurse. Rukayat is a pharmacist, right? So we've been in these systems, right? And we understand what it's like when you're in a system where you know that things are not the best that they can be, but you feel like there's really not much you can do about it, right? You feel like it's not your place, like it's beyond your scope, it's out of your hands, right? And so when we're developing this course, this is really, really, really what we had in mind, right? Beyond developing a course for people that have background in quality or are looking to learn more in quality, it is even for every clinician basically that wants to improve the quality of care that they give, right? To be able to get this hands-on experience and tools that can help you do that within your space, whether your scope is just your unit you're able to influence, or whether you're someone in a quality role that's able to have influenced the whole facility. What we did basically was, or what we want to do basically, is to give you access to it. And that's again why we agreed or decided that this should be a lifetime access thing, because we don't want you to just take us, when you get the information first time, you may feel like, oh wow, there's a lot here, and then you want to go over it over and over to be able to pick the little things and work with them. And then as you implement, you're able to go back to the course again and check things again and, use them as you go. And this is why we decided that it should be lifetime access. So beyond getting CME or getting certificates and all, the idea behind the course is to give you a tool or give you something or arm you with resources that can help you understand, how can I be a better doctor? How can I be a better nurse? How can I be a better care provider? How can I improve the quality of care in my healthcare facility? How do I give my patients the best? How do I make sure that I do great at what I'm here to do? That's basically what this course is supposed to be about. I'm sorry for speaking so verbosely, Obina, but I just felt like it's very important to communicate that, because we're really, really passionate about the course that we created, and we wanted people to understand that it's from an insider perspective.
Thank you, Fati. No, I'm not surprised. I know I would have to do a lot to tame your passions in this meeting today. So it's fun. I really, really understand. Thank you for pouring out your heart there. I love something Dr. David said. He said, having a good heart is not good enough. Wow. I used to think then that everybody who goes to become a doctor, must be someone who loves people and all that. But we're seeing today that once there's no system, all right, and like Fatih just recently said, even when you have good intentions, a bad system will inadvertently make you produce, a not so great result, right? So, Rookie, I was on you, right? So, what are the practical outcomes? So, um, if I partake of this course today, let's say you are able to convince me and not confuse me that taking this course will benefit my practice. What are the practical outcomes that I should expect going forward?
Thank you, Bina. And Fatima has really covered a lot of points that I had in mind. But just to add to it, participants should expect to have a deeper understanding of quality management principles, the processes and tools, as well as the ability to apply them in a real-world healthcare setting. Also, you'll be able to identify gaps with this training. This course will guide you and train you such that you'll be able to identify quality gaps in your own organization. You'll be able to, compare what is the discrepancy between your current process in your own facility and compare them to a quality standard for you to be able to implement a system that would indirectly lead to improved patient outcomes. This course would also help you to be able to implement process improvement and intervention to improve the service delivery. Overall, this course will empower participants to become change agents who will now promote sustainable, high quality, and patient-centered healthcare. So that's just a summary of it. Thank you, Bina.
Wow. Wow. You said so much, and yet you called it a summary. Thank you very much. So now I'd like us to be in the next session we're going into to be as brief as possible. See, I want to milk you as much as I can, yet I don't want you to tell them everything about the course, right? They should go and register, right? If I don't even have the forum to get out everything from you. Now, so fatigue. There's a module in the course that is tools for improvement and then incident management. Now, how are these two interlinked in achieving healthcare excellence? Did you hear me?
Yes, I can, Obina. Thank you very much for the question. So,
Yeah.
looking at incident management and tools for improvement, right? I mean, they are very much interrelated because when you have an incident that has occurred and you want to address that incident, you basically look for tools that can help you, work on the incident to improve the process, right? So, to give more or to give context to it, we know that an incident is basically, to put it in a simple term, is when you've had a safety event, right, in your facility. And when those such events have occurred, you basically now apply the tools for improvement, whatever tools, basically the tools that we've included, tools like so your 5 Ys, your fishbone, your A3 PDSA, and FMEA, Pareto chart. All of these tools are tools that you basically can now apply when you are having incident or patient safety issues or that have occurred to help you find out, okay, why is this occurring? It helps you. Even tools that help you gather data to even get that data-driven decision making so that you make sure you are working on facts. You're able to figure out why things are happening and then now apply solutions and test solutions that would help you improve a process so that the patient safety event does not recur, right? So think about it as a way of reducing risk in the process, that is incident management, and then you're able to now use your tools for improvement to reduce risks when it comes to patient safety in your practice. Thank you.
All right. Thank you. Thank you, Fatih. There's a lot of echo on patient safety. So, Dr. David, patient safety is a cornerstone of healthcare quality. The key international patient safety goals you focused on in this module, and why are they essential?
Very great. So the scenario now, right? Very quick. How does it feel to go into surgery, right? And then let's say emergency cesarean section, and then you come outside months later, you develop some abdominal pain and some progressive swelling, only to discover that they forgot towels and gauze in your stomach, and of course it's infected. And then all of a sudden you're now thinking you have to go in again for another surgery. That it's crazy. We see a lot of these stories every day. Well, how does it feel to go in, to the dentist and they tell you, okay, you tell them you have a right toothache and a severe one, there's a hole in the tooth, and then when they go in, they remove the wrong tooth, yet you still have the one that is bad in the mouth. How does it feel? It's also crazy. And look at the scenarios that Rukaya was trying to mention regarding how somebody who should get a particular drug like amlodipine ends up getting digoxin. It's so crazy, and that's why we have this international patient safety goal, very important one, and it's to help people align. So for me, it's more than just it's more than just a compliance document. It's more than a policy. It's a culture. It's about culture. It has to be a lifestyle, right? It's a mission. It's a daily habit, right? And it highlights 6 goals, right? International patient safety goal has very, very important components, and there are 6 in number. And some of these scenarios that I mentioned can be greatly avoided because, I kid you not, one medication error, right? One misidentification of a patient, and I'm emphasizing it very well, and one misstep to perform hand hygiene can lead to life-altering consequences. And that's why IPSG is more than compliance. IPSG is more than policies. IPSG is about saving lives, right? Or yeah, it's about saving life. IPSG is about making sure that you fulfill the promise you make to people who trust you with their lives. Okay, so very shortly, the goals are 6, right? Identifying patients correctly, trying to make sure there's effective communication, trying to make sure that there's safety of high alert medications, including controlled electrolytes, and ensuring surgical safety, improving the risk of healthcare associated infection, and also improving, right, the risk of falls, right, or harm resulting from falls. And these goals are looking at it. Fatima directly mentioned that Joint Commission looked at some of the areas where most of these patient safety issues happen. They did a root cause analysis of many sentinel events. They did an analysis of many high-performing healthcare systems worldwide, right, and came up with these particular 6 goals. And if you can have these 6 goals up and running in your healthcare system to a large extent, you play a very significant role in improving patient safety. So this is a cornerstone. It's the beginning, it's the basic, it's the starting point, right? So I advise everyone to have an understanding of this and then implement this wherever they are working right now. Thank you. I think I can stop here because there's a lot more to say.
Thank you, Dr. Devi. Yeah. So, Rukayat, may they not forget towel in your stomach. So, Rukayat, how do you see quality systems influencing everyday decisions in healthcare? What do you think would be better outcome? What's it going to look like? So give us a scenario of a picture of where quality management system has been implemented. What's it going to look like?
Okay, thank you, Obina. So quality management system influence everyday decision by providing 3 key framework: continuous improvement, data-driven decision making, and adherence to best practices. For an effective quality management system, you do not just react blindly. Maybe a particular issue happened, you just react blindly. No, you make decisions based on accurate data, aligning them with clinical best practices, and also supporting the continuous monitoring and improvement of your processes. I will give example in relation to the scenario which I gave regarding the medication error where digoxin, which is a medication for congestive heart failure, was wrongly dispensed to a hypertensive patient in place of amlodipine. So first is to encourage a safety reporting culture to gather your data, yes. Then analyze this data. Example now, gather your medication error report for the past 3 months. Then analyze this data. So let me give an example. While you were analyzing this data, you were able to identify that one of the main 80% of the medication errors were due to dispensing errors because digoxin and amlodipine, that's both medication, they look alike in their packaging. That was the cause of this particular error. So now you've been able to identify a gap from your data analysis. It's this data analysis that you now use to make that decision that say, okay, let's implement a warning label for look-alike, sound-alike medications, or let's have on our EMR warning alerts that whenever you're dispensing medications that look alike or are high risk, you get a warning alert so that you can be able to do your double check. So this decision or this improvement process was made because of data, because of your data that you're able to collect. So another area again is for an effective management system is that it promotes the use of evidence-based guidelines and protocols. I will give another example. You have a healthcare facility that implements a quality system, and ensuring that this quality system aligns with, let's give an example, hypertension management protocols with the American College of Cardiology or American Heart Association. So by standardizing this care through this guideline, it's not that a prescriber just wake up one morning and see a hypertensive patient and just prescribe any medication that comes to his mind or follow a particular care which he decides. No, he's making that decision based on evidence-based guidelines. So that is what quality management system does overall. Thank you, Obina. I hope I
Thank
wasn't
you,
too long.
Ruki.
Yes.
Thank you, Ruki. So you're saying that we'll be making evidence-based care, we'll be giving evidence-based care, we'll be making decisions based on data, and so definitely there'll be improvement on whatever we have done before, right? So I'll ask you a follow-up question. So what can health leaders do, to build a culture of quality and continuous improvement? So because I believe that amongst us in the call here are some healthcare leaders, and you have also risen to be such a leader yourself. So what do you think they can take out from understanding of this course and imbibing the practice? Thoughts?
Okay, thank you, Obina. I wouldn't want to give all the gist, so I will just give more like a summary because
Yes,
I
summaries,
spoke
please.
a lot about leadership, very important in quality management system. They are the drive. So what leaders can do is first build that commitment. Leaders need to demonstrate that they are actually committed to implementing an effective quality management system. How can they do that? It's for them to actively participate and support quality initiative, encourage their staff, and even model desired behaviors in the sense that, we've had facilities or organizations where their leaders are resistant to change. They are not committed to implementing an effective quality management system. And as a result, most of these facilities are still using outdated system and procedures, which is negatively impacting on patient outcome. So another area, again, that leaders can drive this culture is also to foster open communication where their staff are not scared to really express, they're not scared to, make suggestions, give ideas without fear of retribution, and also to equip your staff to train the staff, build them, because it will indirectly contribute to quality improvement. So there's a lot more. It's a long list, but this is just a summary. Thank you, Obina.
Yeah, thank you, Rukia. So staff leaders should have a system, where people can freely speak, and not imbibe the African system where whatever the elder does is always correct, right? So yes, Fatih, now over to you. I guess your network is better now. Now, which improvement tools? I want you to tell us all of this. Okay, can you give an example of how effective incident management can prevent future harm in clinical practice. I'll take that again. If you have an example of how effective incident management can prevent future harm in clinical practice.
Thank you very much, Obina. So I think in some way, Rukayat has even kind of covered this with her example of talking about the medication error of giving
Mm,
digoxin instead of amlodipine to a hypertensive patient, right? So the idea is, like she said, first step is, when you have a system where people are able to report errors like this, and you're able to apply the incident management process to it to be able to work on it, find what the main cause is, and then implement sustainable systems to prevent that. Basically, that is what the incident management system then does, preventing errors, preventing recurrence of these errors. Because to be honest, a lot the incident management system is more about prevention than correction, because we understand that the error has already happened. We can only try to, manage it as much as possible. But the question is, we want to make sure that we don't repeat our mistakes again. We don't want to repeat the same thing again. So the incident management process is basically helping you to be able to do that. And in the example that Rukaya gave, she talked about how you're able to gather your data and figure out that the reason is because the medications look alike and sound alike, and look alike rather. And maybe your solution might now be to have a system to help you manage that, like your warning labels or putting the medications far away from each other and things like that. And then based on that, you're now able to alert people whenever they want to dispense such medication, so that they take a second look or step back and make sure that they're giving the right medication to the right patient, and as such, preventing future errors associated with that. So that's just the whole mindset of incident management, preventing recurrence, reducing risk. Thank you.
Thank you, Patty. Thank you for sharing that beautifully. I'd like to remind our participants that you can interact on the chat section and ask any question that you need to know. And like we said, the course is still available, and there's a discount and a window period for that discount, right? As a matter of fact, if you check the registration link, this course is not supposed to be going for 35,000 naira. But for those of us who are going to attend this webinar or who are currently in this webinar session, you have the privilege to register for just 30,000 naira, right? And if you look at the chat box or the chat room, we have also shared the registration link to the course. And I see some people have already tried to engage that link, and also the account number for payment. So if you're not able to go through that link, all right, you can pay directly and send the payment details to the WhatsApp link. Okay, so there's much more to learn and gain from the course. Now you see me cutting the panelists in within their answering sessions, because that's not going to be an exhaustive forum for all that they're sharing, right? So we'll have in the main training session for those who have registered, each of these presenters will have a full 2 hours to interact with you on everything you need to know as far as the area on the module that they have developed. And I tell you to be more interactive than this. Yes, it will be a class, but then you can break in and ask questions. You can raise up your hand and ask questions. And then there's also going to be post-training hand-holding sessions and mentoring sessions where you can still ask questions as you go to implementation and you're meeting some bottlenecks, right? You can still consult, and then we'll help you through. So Fatih, I still want to ask you again. Now, can you share a specific example? I know people learn better by examples. You know, those days when we learn maths in class, the teacher always starts with an example. Even though sometimes in the exam, he gives us something more difficult than the example he gave us. But then he starts with an example and expects that we can apply the example to the scenarios. You know, sometimes when we make it very theoretical, you know, people tend to say, well, they're sounding very intelligent. But can you share a particular example where a quality improvement tool made a tangible impact in your facility or any project you've handled?
Where to begin? So many. So just to pick, let's quickly look at one. So I know of an improvement project that was done on, let's say, informed consent for procedure. So you know how, of course, informed consent is something very important that you have to take before every procedure. And this is not just major surgery. For any procedure, even if it's going to be a bedside procedure, you need to get that informed consent, right? So I know of a situation where we're able to apply the A3 tool, also, a version of the PDSA to delve deep into the reasons for not getting compliance up to par for informed consent, and using that to determining what the causes were and looking for ways to strengthen that system, right? And the funny thing is, one very, very funny thing that happened was that it was actually clear, or it became clear during the process of the project, that the major problem was the system. We had there was a very cumbersome system, or a very cumbersome process of getting the consent, documenting it, scanning it, attaching it. So a very, very lengthy process just to get that consent document to where it needs to be. And then you're now having situations where the consent was taken, it's just not where it's supposed to be, so you can't find it. Right. So these are the kind of interesting insights that you get when you start working on different improvement projects and root causes and all. Because again, like I said, nobody wants to do the wrong. Everybody wants to make sure they do the right thing, right? But the system needs to be able to support them to do that. So this is just a snippet of an example of how we were able to apply the A3 tool to improve the process for informed content. Thank you.
Okay. Thank you very much. Just in case what Fatih said sounds like a jargon, well, we actually do what we intended it to be. We want we want to demystify the jargon for you when we come to the course, right? Fatih mentioned something called A3, and then she added thinking. So A3, and then there's a thinking. So what does it mean to be thinking in A3? Well, Fatih will meet you in class once you join her. So I'll go back to Dr. David once more. Okay, before we do that, I see someone has asked a question. So thank you. We can take some questions now and allow maybe some of our presenters to breathe, maybe take a cup of water. I didn't tell you to come with water. I hope you have water. All right. We're in a TV session, I would have provided tea for you, but I hope you're fine. All right. Now, Kasim Ibrahim is asking, does this course cover all the clauses or only clause 10 that speaks to continuous improvement? This looks like a David Asham's question. Am I right? David, is that for you? Or any one of us, any of the panelists can pick it. Okay, Fatih's hand is already up.
Okay.
So David, breathe.
Okay.
All right.
Yes.
So to answer your question, Kasim, this course is not developed as a course that tells you how to implement ISO. Because when I see plus 10 continuous improvement, I know you're talking about ISO 9001, right? But this course is more of a practical step in helping you understand the general quality management system, what it is, the foundations, how to start, how to implement. It's not just, continuous improvement we're talking about. Again, the structure is not set up that will take you through clause 4, clause 5, and all of ISO. It's not designed to be a course to teach you ISO specifically, but general best practice for implementing quality management systems. So you have a specific model, in fact, that talks about quality management system as one. Then we now have other parts that now talks about the tools that you can use, talk about the incident management process, and then also talk about patient safety as a model on its own. So it's an all-encompassing course, and we did not create it with the format of ISO. We created it as a generally based on best practice. And that's why when I was talking, I talked about how we didn't just look at ISO best practice. We looked at things like your Joint Commission and others when we're coming up with the course. I hope that answers your question.
Yeah, thank you very much, Fatih. Kasim, I hope you heard Fatih. Yes, and said it's a general course. It speaks broadly to healthcare practice, right? Now, okay, so this question is asking, this is a very insightful webinar. I want to ask if EHA Clinics Academy is open to partnerships or engage collaborators outside Nigeria. Yes, yes, yes. In fact, my manager has been on me to go and look for to go and look for partnerships. All right. So please, um, one of the numbers that was shared there is the WhatsApp number that you can engage quickly, and then you can shoot a mail to us. I'll drop an email address right now shortly, so that you can start that conversation. And if there's any aspect of our clinic or even with the university that you want to commence this partnership with, why not? Please, when is the course starting? I registered but haven't received any specific email. Okay, so I'll send you a mail also, Mr. Taver. I'll send you an email, but I'm writing it now. It's academy at EHA at EHA.ng. Right. So you can send any queries to this email and we'll take it up from there. Or you can also send a WhatsApp message to this number that I just dropped now. I'm deliberately doing this so that our guests, our panelists can have a breather, all right, as we're going into the last session. So please, and my assistant Agatha will drop the links again so that you can engage it as we look at the last sessions of this webinar. All right, now, so Dr. Ashton, how would you balance patient expectations? Thank God it's good you're a medical doctor. How would you balance patient expectation, then regulatory requirements and internal quality standards, right? Um, um, so how would you balance it? You're a professional, you practice these things. How do you do it day to day? If you have scenarios, beautiful.
Okay, fantastic, right? So the first things first is you want to balance patient expectation, regulatory requirements, quality standards. You just want to make sure that everything meets that point, right? All enemies, whatever one, right? But of course, every patient wants to go to a healthcare setting that is safe. Every patient wants to access a healthcare system that works. As a matter of fact, patient safety is not a privilege; it's a right. So it's the responsibility of every healthcare organization to implement a quality and patient safety focused care, right? If that is the true north of your organization, then you've gotten the first step correct. If that is where your organization focuses its time and energy on, right, that is the first step, right? And that focus will require regulation. That focus will require quality standards and a continuous monitoring of such standards to make sure, right, that it is maintained. So you have that ab initio as a foundation, right? Patient expectation can now come in here because, of course, when they come in, they expect that they are safe. They expect that the quality of care is fantastic. They expect that there are no harm, right, when they come in for healing or come in for treatment. How you balance that now is to keep in mind on patient feedback. So you should have a very robust patient feedback mechanism. You should be able to have patient satisfaction surveys and levels, right, assessed, so that what they say, right, you can use that as a feedback to improve your own quality standards. So that brings you to that balance because we've already established that you are quality focused, patients want quality. So that establishes the foundation, right? You now have to have a patient feedback mechanism that works. There are a lot of organizations that don't pay attention to patient feedback mechanism, and that's a problem, right? Because you don't know what the patients are saying, you don't know what they think, you don't know what they want, you don't know what their needs, you don't know where to improve, right? You don't even know if your systems are working, right? So very fundamental is the patient feedback mechanism. So if a patient had an issue with your organization, he should be free to be able to tell you, right, with your feedback. So if you do not have one today, please go to the course. There's more of that, right? And then you can use that, right, to develop yours, right? Another thing again is your policies need to align with national and international guidelines because they also protect patients. It's about the patient, right? So your policies that you have, your standard standards, your quality standards, your regulatory frameworks, or whatever you have, needs to align with the guidelines. What is acceptable? There are a lot of organizations that don't even know that there's a National Health Act. Let's come to Nigeria. There's a National Health Act of 2014. And we preach this a lot, right? I can quote section 20 subsection 1 that talks about emergency care, and make sure that emergency care, no organization for whatever reason should deny any patient emergency care. Subsection 2 says if you should breach that, you are liable to 6 months in prison and or 100,000. So if you have a policy in your organization, it must comply to this act. It must comply to the guidelines, right? And you should have a feedback mechanism where you get patients, feedback, and then use that to improve, right? So you need to think around this, and that brings you naturally by default to the balance, and then you have balance amongst all three: the requirements, the quality standards, and patient expectation. I think I can just say this little here so that we don't. Thank you.
Yeah, thank you, Dr. David. To be compliant with what we're doing here, we have also developed a webinar survey. Dr. David said we should be surveying everything. Agatha, please post our survey link, right? Let people tell us so that we can improve. Abi, doctor, that's what you said we should do, so that we can do better the next time we have the privilege to do something. Thank you very much, Dr. David. So, Rukaya, so what are the foundational elements of a QMS that every clinic or hospital should prioritize, right? And I want to believe that this was treated in the course, but what do you think we should look out for so that if they are going through, they can say, yes, this course really meets what I was told in the webinar? Yeah.
Yes, I explained this in full detail in the course, so I will just give just a short summary. So healthcare organization, clinic, or hospital should prioritize leadership commitment. Very important. When you want to implement a quality management system, it doesn't start from down to the top. It starts from the top. So you need active support from your leadership. And also for you to be able to implement quality management system, it has to be patient-centered. It has to, you need to have the right goals in place. You're focusing on patient needs and focusing on making sure that you're getting the right outcomes. Another thing again, which my other co-panelists mentioned, is the standardized processes and SOPs should be evidence-based. You don't just wake up one morning and just write a process. There should be evidence-based reason why you are putting up these policies. So another element again is even the human resources, very important. You cannot achieve an effective quality management system without the people. So you need to focus on how you can equip your own team, train them, build on their competency to align with the quality management system. So that's just a few. I don't want to give all the juice, but that's just a summary of it. Thank you, Obina. You get more information on this in the course.
Yeah, of course. Thank you, thank you, Rukaya. So I'm not sure how many healthcare leaders we have in this meeting, but I've seen a few. So what we are doing is this meeting is being recorded. So it means that you can have access to it after. All right. So let's say you are just a member of a healthcare organization, and you may not be a decision maker. But John Maxwell wrote a book and he called it 360-degree leadership, and he means that everyone can lead from wherever they are. So perhaps one of the ways you can lead or influence leadership is to take this recording and just tell your boss or somebody who is a healthcare influencer in your organization, I attended a webinar and I think there's good stuff there and I want you to partake of it. That may just be the right seed to sow to help that organization. So you'll have it as long as you register and we have your email addresses, we'll be able to send that. Okay, and then Fatih, I would like to ask you this question. Incident reporting. Someone, I think one of us mentioned here of having the leadership. I think that was Rukaya, having a leadership that allows people to freely speak. So I'm going to ask you, Fatih, incident reporting systems are often underused, right? Either because it's non-existent or the culture is not promoted where it is existent. Now, what can facilities do to encourage, especially a no-blame culture for reporting and learning from errors. Share is not that when I talk, I have just put myself in trouble. Is it not safer to keep quiet and let sleeping dogs lie? Please go ahead, Patty.
Thank you very much, Obina. So this is a very common one that most people experience when implementing incident management systems. I think a lot of people's hardwiring is not designed to come out and say I something went wrong, or I realized that I've made a mistake, or something just didn't work, or something is not right. We are not particularly, we don't have that would I say inbuilt nature. A lot of us don't have that inbuilt nature of coming out to say that something has gone wrong, right? We don't. And that's where that whole idea of underutilization of incident reporting systems can come from. And looking at the no blame culture part, that is a way that we can really, really get people to buy into that idea of incident reporting and management. The major thing to look at here is consistent communication and your commitment to that no blame culture, right? Consistent communication in the sense that you constantly communicate that and let people understand that you have a no blame culture, a no blame policy for reporting incident, and explain what that means. Then following through, the commitment is now when people actually now report, the few people that report, what do you do? How do you manage that? From the lowest level, from the front line up to all the way up to the leadership, how do you handle it when people report? Are you pointing fingers and saying, oh, so we figured out that the reason why this thing happened is because you did not do this, you did not do that, your punishment is suspension, or you are at fault, this is your fault, this is this, this is that? Is that what we do? Or are we supporting people and helping people to take learnings and understanding and even focusing more on the systems, right? So basically, the idea is you want to communicate and you want to commit to that no blame culture. So it's not one thing to say something, but you also have to make sure you follow through every time it happens. And in a case where you see that it's not being followed through, you also call it out and make sure that that is corrected, because people need to see you implementing what you say to believe it, basically. Yeah, I think I'll just stop there.
Thank you, Fatih. I think this is very good that leaders will hear this to improve the culture, or else you can't say you want it, and then on another hand, you're putting punitive measures and you're not doing the talk. Right. So I have a question from someone, from one of our guests. He said, "Good afternoon, Simon. Thank you to the panelists and the moderator for sharing your thoughts and experience. Please, we talked about data-driven healthcare system. How can we go about that when our society rarely appreciates data and research?" Before my panelists talk, how can we come and buy the course? The answer is there. Part of the answer is there. And the leaders will also take us through. But do you want to say anything? Don't say too much. If you sell the course here, you will pay me. All right. Um, hello, Dr. David, can you hear me?
Yes, I can hear you now. I can hear you. You're back.
Sorry, I think my own network was affected. Yeah. So would you okay, I don't know if Fatito was affected.
Okay, yeah.
Okay. So Fatih, will you talk briefly about it, and then David will also add some thoughts.
Okay.
So
So to answer your question, first
I'll
of the
take it
question,
again.
can you hear me?
Yes. Yes, I can
Okay.
hear you. Did you get the question clearly?
Yes, I got the question. I can even see it in the question box. Yeah.
All right.
So the thing is, you have to first look at what kind of data are you collecting and why are you collecting the data, right? So when you say our society doesn't appreciate data, so what is the scope of this data you are collecting and why are you collecting it, right? I always tell people start from home. Like, how do they say charity begins at home, right? You want to collect data, communicate, start with the ones closest to you, right? The people or the area you're able to communicate and look at the reasons why it's important to collect this data and help people understand that, and get to collect the data. And at the end of the day, you have to make sure that whatever data that you're collecting, you're not using it as a way to police people or to make people feel like you are would I say you are collecting data to show them where they have gone wrong, or to use it as a way of punishing or punitive measures or something like that, if you get what I'm saying. So you need to be able to communicate that the whole purpose of data collection is a positive thing, like share it in a positive light and make sure you understand why you are collecting data. We generate a lot of data, right? Even if we don't look at it or collect it, but for any data that you want to gather out this thing, there needs to be a reason so that we don't just spend our time collecting data. And if that reason is good enough and important and valid to the people in that space, they should be able to come through. So let's not rely on the general system of what people usually accept or not, right? Because it means that we will not move forward. It's the same thing with incident reporting we talked about. If we rely on the general belief that people do not want to come out and say, so I've done something wrong, then that means we'll just never, if we believe that that's how it is, we'll never report incidents. So we need to find a way to move forward and to help correct that. Start small, start somewhere. I hope I've
Okay.
question.
Obina, I would like to add to what Fatima said. Another area again to support data-driven strategies is even the leadership. Your organization, the leadership also need to drive that culture that whatever decision we are making it based on data. So data is more valuable in your own organizational culture. Thank you, Fatima.
Yeah.
Thank
you. I want to ask Obina, please, because
okay.
There's no improvement without standards, and standards have to do with data. You need data to have a baseline, right? And in an organization or a setting where data is not appreciated, people shy away of data, you that have the vision, that's why I say a role for the cause. It needs to start with, right? And then you can prioritize one of those things you've seen as an issue you want to solve. Get that data from them, right? Then you can showcase that data and engage leadership. Get their buy-in. When you get their buy-in, then you can move to the next step. You want to pilot phase in a particular department, a particular unit, and then see how that works in terms of your improvement. And then when that works, when you have wins, showcase that win. Showcase them, show them the improvement you've done, right? And that's how you get more buy-ins, and that's how you get people getting out of that culture. Because I know it's a system. We just think that, okay, now statistics we go chop, right? And that's what we hear a lot of the times. But you need to start, especially begin with you consciously, giving evidence-based results that can happen, when you just focus on data and improve, right? And then people buy into it. I just wanted to just put that in there in addition to what Fatima rightly mentioned. Yeah.
Thank you, Dr. David. Beautiful contributions. Betty said we generate a lot of data. Rukaya said we can begin to internalize the use of those data even in-house. And then Dr. Ashim has said, okay, even when those data produce beautiful results, let's showcase them. Right? These are some of the practical ways. There'll be in-depth and more practical right to this. So our registration link is there. If you just logged in and you're not seeing it, just drop a chat there. But my assistant will be putting up all that you need, the account details and the WhatsApp number for if you need to directly speak with someone or chat someone. And then the registration link to the course is also there. So we have someone who's been wanting to share thoughts as we begin to close out. Kasim Ibrahim. Kasim, can you hear me? I'll see to enabling you to speak, Kasim. Yes, Kasim. So you can unmute from your end, Kasim.
Hello, can you hear me, please?
Yes, we can, Kasim Ibrahim. Good morning.
Okay. Good morning and good morning to all panel. Actually, the first time I saw this topic, I'm so very happy that healthcare is coming they are now coming to the system now. We have been driven around, let me say, 19th century, which we are still practicing the whole system or in the healthcare system. But coming to this system to bring, or let me say, to even develop this topic is very, very important, and it will go a very long way. However, what I wanted to say here is that, yes, there is data-driven, there is collection of data, continuous improvement, and so many things. You know, before data can be collected, I'm just, basically why I wanted to actually speak is to say to the people who bring upon this or who develop this, this topic, which is very important for them to also look inside those systems that support this particular topic, because quality management cannot be fulfilled without those things in place. Though I had the mention of different different tools at which you'll be able to ensure continual improvement, and tools you can use to actually look for loopholes and what have you, which are the 5 Whys, Fishbone, and what have you, which are basically around the Six Sigma, which can either be black belt or even yellow belt or whatever it may be. Then I wouldn't know if they can also bring upon or also talk about, or maybe develop a topic that have to talk about VACCP and also TACCP. These two different components
Hello, Kazim, I guess we lost you.
are very important to support actually the quality management system, which is the vulnerable assessment, critical control point, and also threat assessment, critical control point. Why did I say so? There are so many healthcare workers there. Some of them may intended to actually harm, and some may not be intentional. Then which also this can support the data-driven and also quality management system, which the course is all about. I wouldn't know if other courses can come upon, which can also speak to the VACCP and also the TACCP, in the sense that there will be a control point within the health facility. You know, you saying we have a quality management system without having a control point, a control unit, or a control limit, in the sense that, okay, when you are, let's say, for example, you want to conduct a surgery, then maybe you want to inject a pain reliever, and in the sense that some people will just continue to be adding more dose without giving a certain limit. Then due to the how can I put it? Drugs, how can I put it? The drugs composition, or let me say,
will you try to round up, Mr. Kazim?
Okay, yeah, I will quickly just round up now. The reason why I would do a main thing I just want to say, though they can also check on what the VACCP is all about and the TACCP is all about, which can support the quality management system and to go a long way for us to be able to drive the healthcare system to the standard where it's supposed to be today. Thank you very much, Obenna. And thank you.
Thank you, Mr. Yes, thank you, Mr. Kazim, for that contribution. Like we said, this in another way we could say this is like a starter course. It's fundamentals, right? Some people are not even practicing or have not even embraced quality management system. There's always a starting point. There's always you count one before you count two. So this is to give people a platform to first of all embrace it, right? Let them see a gap between what is their current practice, all right, with what it could be with the best practices that are globally accepted. You understand? So this is the question that this course seeks, all right, to answer. So having appreciated what quality management is in healthcare, then we are giving you steps on how you can begin to implement, all right? And we said those who would register for the course will have the privilege to also interact further with our panelists and our modules, and then you can take it further, as the organization gets buying to the course. So the details for the registration are there. The cost is just 30,000 naira, which is a discount that is for this program. So as we round up, I would like to take one final statements from our presenters. I'll start with you, Dr. Ashim. Thank you, Gabriel, for that feedback.
Final statement, yeah, I would say it's essential that every healthcare organization implements quality management system. And this is the beginning. This is like the starter course set. So if everyone can have this understanding, can build awareness from there, right? And then make changes in aspects. So please enroll for the course, and let's see you somewhere today. Thank you.
Thank you, Dr. David, for those kind words. Yes, Rukaya.
Oh yeah, I think one last message I would want to share is quality management system. It's not a one-time project. It's a continuous journey. So always start from small. And also it is not a one-man business. It is a team effort. So whatever you're going to learn in this course, you should be able to share with your team and also guide them so that overall it will be of benefit to the whole organization. Thank you, Obina.
Yeah, thank you, Rukayat. Yes. And then Fatih, what would you have us here?
So I know we've said a lot already. I particularly am going to be taking the models on tools for improvement and incident management. And all I can say is I look forward to meeting you guys in class because that's where we get to, dive deep and, really talk more about all of these things that we have talked about here. So I'm very passionate about improvement. I'm very passionate about incident management. So I hope that I'm able to share what I know, the little I know basically with all of you in class. And, we're going to interact better in that session. But I hope that you have gotten an idea from this, basically what the course is about. And, you now understand why it's important that everyone, gets the basic information about how they can improve quality in their own space, in their own practice. Thank you very much.
Thank you. I'm seeing a lot of beautiful feedback that I say. Some are saying I have registered and they're looking forward to meet our instructors in class. So for the 4 modules, like I mentioned, Fatih has just told us that she developed 2 of the modules, which is incident management and tools for improvement. Dr. Ashem worked on the IPSG, International Patient Safety Goals, and our supply chain manager, Rukaya Yunusa, developed quality management systems. All right. So for those feedbacks, I like the feedbacks we're dropping on the comment section. We have a link to our feedback. We'll be glad that you can send us those. You can click on the link and give us those feedback. Now, today's session has given us just a taste of what it means to build a culture of quality healthcare. Now, we can entertain all questions here, but focusing on patient safety, continuous improvement, operational excellence. But we also know that these are complex issues that deserve dedicated time, practical guidance, and structured exploration. That's why we're excited to invite you to the official launch of our new 4-module course, Fundamentals of Quality Management in Healthcare, which is developed by EHA Clinics Academy in partnership with Erazi Medical University here in Kano, right? This course launches on the 9th of June, and it will commence, all with the 4 intensive modules. So the plan is that each of the days, we're going to have a 4-day session. Each of the days, all participants will be sent a login, and they would log into, so every module will be treated on each day, all right? So day 1 will have the course developer take us extensively practical sessions, discussions, feedback, all of that happening in that 2-hour session. It's going to be intensive, right? And that's how we're going to do that and run for the next 4 days, beginning 9th of June. All right. So please, if you have not registered, please do register. If you need to contact us, our details have been shared. The EHA Clinics Academy email was shared. The WhatsApp number has also been shared. You can use any of that to contact us, and we'll give you the information that you'll be required. I want to say once again, thank you Dr. Asham, Rukaya Yunusa, and also Fatima Abubakar for unpacking, the crucial topics and setting the stage for deeper learning. Thank you for your contributions. Thank you for your time. I know that you as leaders will lead a very busy schedule, but still afforded us this opportunity to share these thoughts with us. We are indeed grateful. All right, and to everyone who has attended, thank you also for your time. Without you, also wouldn't have had a very engaging time. So I'll be expecting to see you on the other side of this webinar. So please, I want your disturbance. Reach out to me, ask all the questions, use the WhatsApp number. I directly receive messages from that WhatsApp number, and I'll afford you all the information you need. And those who need the recording because they want to make a case with their management, all right, we're going to quickly prepare it and send it to you so that you can continue making a case. Thank you very much, everyone, and do have a great day ahead. Bye.
Thank you. Bye.
Bye.
Hi, everyone.
Yeah, bye.